Hi, welcome to Qigong with Kevin. Today we're going to talk about belly breathing and the fundamentals of diaphragmatic breathing. This episode is sponsored by Bridge Community Acupuncture in Largo, Florida, a wonderful place. If you've never been there, you should check them out. So last time we briefly talked about the benefits of belly breathing, but I want to tell you today what belly breathing is, why it's beneficial, why it's healthy and better for you than chest breathing, and give you a few tips on how you can get started doing belly breathing throughout the day. So first of all, let's look at our model here. This is the diaphragm, and the diaphragm runs above our liver and our spleen and our stomach, right below our lungs. Typically with chest breathing, we use our neck muscles and our chest muscles to breathe. The diaphragm with chest breathing stays here in this fixed location generally. So you have a limited amount of space for the lungs to expand and contract. However, with diaphragmatic breathing, you, on the inhale, push your belly out, the diaphragm drops down, and it depends on the person, but in many people, you can increase the lung capacity by up to 20 or 30%, which is a huge amount, increasing heart health, getting oxygen to all parts of the body. So diaphragmatic breathing is a very good health practice to learn and to put into your daily routine. So how do we do diaphragmatic or belly breathing? Well, on the inhale, our belly is going to expand. As our belly expands, as we mentioned, the diaphragm will drop. As the diaphragm will drop, we open up so much more space in our lungs. And belly breathing or diaphragmatic breathing has been a key part of medical Qigong and Qigong practices throughout the centuries. Qigong practitioners, as well as yoga and Tai Chi practitioners, have learned that by doing belly breathing, we can relax our body, we can downregulate the sympathetic nervous system and upregulate the parasympathetic nervous system, relaxing, decreasing cortisol, and increasing the feel-good chemicals in our body. So let's do a little bit of practicing. We're going to inhale through the nose. And as we inhale through the nose, our belly is going to expand. This is just like babies breathe. You remember seeing little babies and their bellies expanding on the inhale? Well, our belly expands. On the exhale, our belly contracts back towards the spine. Inhale, belly expands. Exhale, belly contracts. Very easy. Those are the fundamental aspects of belly breathing or diaphragmatic breathing. Now, you can even go further though than just having your belly expand. And I love to do expanding the side when we inhale. Not only does our belly expand, but our side expands too. And even further than the sides expanding, we can do kidney breathing. And on the inhale, when our belly expands and our sides expand, our kidneys also expand. The area of our kidneys pushes out. So we are really opening up an enormous amount of area, dropping that diaphragm down, allowing air to come in and fill our lungs and resupply our body. It's so healthy for our heart. Now, as always, when you start before you start practicing belly breathing, you need to ask your doctor, is diaphragmatic breathing okay for me to do in my present health condition? Typically they'll say yes, but always check with your doctor first just to make sure. So some of the side effects that you might anticipate when you start doing belly breathing is maybe a little bit of lightheadedness because you're sending so much more oxygen into your body. And so you might want to sit down, find a comfortable chair before you start doing diaphragmatic belly breathing. So that is my tip for the day on belly breathing. It's a great way to replace the more stressful chest breathing, where we get uptight and feel our muscles in our chest contract. And belly breathing is also, I want to mention, a great tool to take with you anywhere. You don't have to put it in a bag or a sack or in a suitcase or a briefcase, because you're carrying that tool with you in your body. When you are at a stoplight, or if you have cars zooming around you and the traffic is causing so much stress, belly breathe. Inhale, belly expands. Exhale, belly contracts. You're going to find that you just downregulate that stressful cortisol, sympathetic fight or flight response, and instead you will feel just a wave of relaxation come over you. So practice belly breathing. I say I like to recommend 4, 5, 10 times a day to start. Sit down in your chair, take a couple of minutes, practice on the inhale, letting your belly expand. Practice on the exhale, letting your belly contract. It's a great way, great first step towards optimum health, and it's a very important tool in learning Qigong, and we will be using it, belly breathing, as we move through different Qigong flows. As always, again, a great shout out to Bridge Community Acupuncture and Dr. Melissa and all the staff there for everything they do. And may you be blessed and filled with Qi.